Good morning, ma'am. I am SITTIE NORHAIDA Ipon of BSN 1A. So now I am going to demonstrate to you the posterior thorax. So first, I will sanitize my hand to prevent the spread of infections and give the privacy of the clients to minimize the embarrassment. So I already closed the door and the window. So inspection, observe the shape and movement of the posterior chest. Compare one side with other to identify asymmetrical shape or movement, assess of the respiratory movement. So palpation. Palpate the posterior wall over areas to distinguish between normal and abnormal structures, such as tender masses, swelling or painful areas. So inspection. Stand behind the client and observe the posterior chest for shape and movement of the assess of respiratory movement. So inspection and palpation. So assess chest expansion on the posterior chest, symmetric expansion. And so now place your hands in the posterolateral chest wall with thumbs at the level of T9 or T10. So slide your hands medially to pinch up a small fold of skin between your thumbs. So ask the client to take a deep breath and watch your expansion with your finger. So sir, can you please take a deep breath? Okay, so I will assess the tactile or vocal fremitus. So begin palpating by using the ball or ulnar surface of your hand from the lungs apices. Touch the client's chest while he or she repeats the word 99 or blue moon, and compare vibration from one side to other side. So can you please say 99 repeatedly, sir?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so next is percussion. So lungs fields, percuss the posterior chest, comparing both sides to identify and locate any area with an abnormal percussion, and percuss the posterior chest from the apices, and then and then and to interspaces with a negative 5 centimeters intervals. So in the diaphragm excursion, this is to map out the lower lung, lower lungs border border both in expiration and inspiration, and ask the client to evaluate and hold it briefly while you percuss down the scapular line, and continue percussion until the sound changes from resonant to dull on each side. So next, the last is auscultation. So listen to the breath posteriorly with mouth open and more deeply than the normal to note intensity and identify any variation, and any adventitious sounds. So So that's all for today. So that is my return demonstration for the posterior thorax.